Okay, good afternoon. We'll go ahead and give first an update on the numbers. Today we had 52 new positive cases for a total of 549 positive cases, 416 negative cases today for a total of 7,304 negative. Total test available at the State Hygienic Lab is 1,449. We have 63 hospitalized as of last evening, and we have 118 recovered. Again, I am so sorry to report that we have 2 additional deaths. Both are elderly adults, one from Polk County and one from Washington County, for a total number of 9 deceased Iowans. When we first heard about an outbreak of an unknown virus across the globe, it seemed almost unmanageable that it could have an impact on us. But in a very short amount of time, it has become a reality. And as the President said yesterday, the next two to 3 weeks is critical time for our nation as we prepare for COVID-19 cases to spike. The actions of every Iowan matter, and we must all do our part to slow the spread of the virus and save lives. The best way to avoid being exposed to the virus or exposing others is to stay home as much as possible. Leave home only for essential purposes like getting groceries, necessary supplies, or medical needs. Work from home if you can. If your job requires you to work at a physical location, keep a safe distance from your coworkers, use good hygiene, and frequently disinfect your work area. Practice social distancing, regardless if you are out in public or just outside in your neighborhood, and isolate if you are sick. If you or a member of your family have symptoms of a mild illness, stay home and isolate yourself from others in your household to avoid exposing them. You know, I know we continue to ask a lot, but we need everyone to take these simple steps seriously so that we can, again, flatten the curve and protect as many Iowans as possible and do everything we can to make sure that we don't overwhelm our hospital system and our healthcare workforce. It really is a difficult time. Iowans are feeling uncertain about their day-to-day life and even more concerned about what's to come in the next weeks, in the weeks and months ahead. At a time when we are focused on protecting our physical health, it's also important that we don't neglect our mental well-being. To help us understand more about recognizing your own signs of stress, fear, and anxiety, and how to care for ourselves, I've asked Director Garrett Claybaugh from the Department of Public Health to join me today. Garrett?
Thank you, Governor Reynolds. As you've said so many times, these are difficult times and we're all in this together. We want to be sure we're taking good care of ourselves at this challenging time. And I'm here today to talk a little bit about what Iowans can do to assure that they're taking care of themselves, their mental health and well-being. There are services here that will help us all navigate the new normal during COVID-19 response. First, I want to run through some things everyone can do at home. First, read and listen to trusted sources. Certainly, these include websites that we sponsor at the Department of Public Health, as well as the Centers for Disease Control. Our websites have very good information, and they're ready to be accessed when you are ready to access information. Secondly, unplug. Sometimes information, while useful, can be very overwhelming. Know when to take a break and unplug from the constant stream of information coming in. Third, stay healthy. Prioritize sleep. Make a commitment to sleep 8 hours in an evening. Get some exercise, whether it's inside the home or outside, and be sure to practice social distancing. Fourthly, control what you can. Wash your hands. Practice social distancing. Stay at home as much as possible. While the fear of the unknown can be unsettling, taking control can help you feel empowered and counteract the stress you may be feeling. I also want to acknowledge several groups that may be especially in need of support at this time. Older Iowans and those who suffer from chronic diseases are at higher risk of COVID-19. For those of us who have loved ones in that grouping, be sure to check in on those at higher risk. And if you're an older Iowan, be sure to ask for help when you need it. People with pre-existing mental health conditions should continue their treatment and be aware of new or worsening conditions. And again, for those of us who have loved ones who suffer from mental health, we need to be sensitive at this time as well. Children and teens also need help coping during this time. So one of the things we can do as parents is just maintain a predictable schedule of activities for them. People who are helping with the response to COVID-19 can also have difficulties during this time. Physicians and other healthcare providers and first responders, these circumstances can all take an emotional toll. And there are things that those individuals can do to lessen that traumatic stress. First, learn the symptoms of that traumatic stress, including physical fatigue and mental withdrawal. Allow time for you and your family to recover. And again, take a break from media coverage. Sometimes these measures, though, are not enough, and more help may be needed. So ask yourself if you have fear and worry about your own health and the health of your loved ones. If you have changes in sleep or eating habits, or you have difficulties with sleeping or concentrating. If you have worsening chronic health conditions, or you find that your use of alcohol, tobacco, and other drugs is increasing. If you answered yes to any of those questions, consider seeking additional help. Certainly, you can be in touch with your healthcare provider, and that individual can connect you to services. Or if you or a loved one is experiencing a decline in mental health or having suicidal thoughts, facing problems with alcohol, drugs, or gambling, you can contact a service called Your Life Iowa by going to the website, yourlifeiowa.org, where you'll find information to get you connected with assistance that you may need. And on the website, there's a live chat function, so it's very easy to engage with someone directly. You can also text for help, and I'll give you the text number for that, 855-895-8398. Similarly, you can make a phone call, and that phone number is 855-581-8111. On the website, there's also a facility locator so you can find a provider in your area. Your Life Iowa is a service that's sponsored by the Iowa Departments of Public Health and Human Services, and it's available 24 hours a day, 7 days a week. We are all in this together, and resources are available to help us through this unprecedented time. Thank you, Governor.
Thank you, Garrett. I really appreciate that. And I want to take this opportunity to recognize Director Claybaugh for everything that he has done the last few weeks. Even with a global pandemic going on, the daily work at the Department of Public Health must continue as normal. And under Garrett's leadership, the team is doing an exceptional job. So thank you for the work that you do day in and day out to serve Iowans and to lead the team. We are really, really appreciative of your efforts and all that you are doing. And finally, I'd like to close with a bit of good news. On March 26th, I ordered that all non-essential and elective dental procedures be suspended to preserve PPE. Over the course of the last few days since that change, dentists from across Iowa have donated their PPE to healthcare facilities in their communities to help during this crisis. I'm so inspired by and grateful for their generosity, and I just want to say thank you for stepping up and making a difference. We are going to get through this. We are in for some rough times, but we are Iowans, and I believe we are going to come out stronger when we get through this. So again, thanks for leading, thanks for making a difference, and that goes to a whole lot of Iowans out there that are stepping up and doing the right thing and helping be a part of the solution as we work through these challenging times. And with that, we'll open it up for questions.
Governor, unfortunately, the last several days we've seen reports of new deaths. I'm wondering what efforts is your office taking to work with county medical examiners and funeral home directors to prepare as we see more and more of these?
Do you want to, you actually talked about that this morning. Do you want to talk about the coordination?
Yeah, so, excuse me, the Office of the State Medical Examiner does exist within the Department of Public Health. And so he works, and their office works locally with local medical examiners. And so determinations about whether there'll be postmortem tested for COVID-19 are really made at the local level by those local county medical examiners under the guidance and direction of the state medical examiner, Dr. Dennis Klein, who works for the Iowa Department of Public Health. And so that's how those decisions are made. They're really made at a local level, but Dr. Klein does provide a guidance and technical assistance to those individuals throughout our state.
But I want to just reiterate also, the different strategies and mitigation efforts that we're putting in place are designed to make sure that we can protect our most vulnerable Iowans and do everything we can to help protect them again, but to flatten the curve and then to protect overwhelming our healthcare system. So we're going to continue to do. We talked yesterday about our long-term care facilities and the steps that they put in place way early on so that we could really be proactive in making sure that we were taking care of a very, very vulnerable population to help, again, just reduce as much as possible the amount of Iowans that are impacted and ultimately die from the disease.
If I could follow up.
Sure.
Have you personally spoken with the families of any of the Iowans who have died from this disease?
I have not yet, no.
Governor, President Trump predicted that as many as 240,000 people in the United States could die of this disease despite the efforts that are being in place right now. What is the state's number they're looking at for deaths in this state potentially?
Well, again, that depends on, the modeling is only as good as the, what's the word I'm looking for? The assumptions, that's the word I'm looking for, the assumptions that go into it. And so, I had referenced a website the other day that the administration was looking at, and they were trying to put the modeling together, but it didn't take into account a lot of the mitigation efforts that we have put into place. And so Dr. Badati is working with that website and the assumptions, and then working with the University of Iowa to take into account, for instance, we've closed schools, the colleges and universities have shut down. We've shut down some non-essential businesses. We've reduced social gatherings to less than 10. We're practicing social distancing. And so some of the modeling that's out there right now, Caroline, does not take those assumptions into account. And so we're working to get those. But again, it is a projection based on the assumptions that we're putting in. So it's really hopefully to help us kind of monitor what we think will be the peak so that we can make sure, again, to find out where the hot spots are at, to make sure the hospitals in that region have the supplies and the equipment that they need and the workforce, and how we can work collaboratively to mitigate, prepare, not overwhelm, hopefully prevent a surge, and hopefully be able to take care of Iowans.
There's a model out of the University of Washington that shows by August, Iowa could see as many as 1,300. Is that in the range of what you're looking at?
You can talk. You want to address that? Again, I don't think it takes into account.
Yeah, Carolyn, so I think you're looking at this exact model here, and so we are aware of the information that's produced in that model. To the governor's point, that particular model does not take into account the measures that have been taken. So, for example, when you look at that website and you look at Iowa, it says that educational facility closures have not been implemented, but Governor Reynolds recommended closure of schools on March 15th. In addition, that particular model does not take into account any of the other non-essential business closures that the governor implemented on March 17th and March 22nd and has now extended through April 7th. And so I think like with any other model out there, there are assumptions that are made. And so our goal in all of this is to prevent illness and death in our state, and so we're making the recommendations to Governor Reynolds that we feel like need to be made, and that includes some of the things that she has done here because we want to protect our most vulnerable Iowans, and so we'll continue to make the recommendations that we feel are necessary to do that.
Governor, I know that you get asked this question every day about the stay-at-home order and the distinction of why you're not doing it, but just yesterday when people were gathering in the streets in Marshalltown to see the dome go up, and is there anything you have to say to make more clear to Iowans that just because they can go outside doesn't mean that they should gather in large groups like they seem to be doing, despite what you've said?
Stay at home. That is the best way to avoid being exposed and to expose others. Essential errands only. Go out as little as possible. Make sure that you're going for groceries or for medical or for just limited trips out. Do them and one at a time. Practice social distancing. You can enjoy outdoor activities, be responsible, work from home if you can. If you're an employer and your employees can work from home, make sure that you're doing it. Practice what I said in my remarks. If you do have to go to work, practice good hygiene, practice social distancing as much as possible. Make sure that you're disinfecting your area as much as you can, and isolate yourself if you're sick.
Governor, just to add on to that.
Last question in the room.
The governor of Florida just today announced that they would do a stay-at-home order after he was resisting that. I think there are Iowans who are curious if this will happen at some point.
Yeah.
Is there any way for you to share more about the data, what exactly those guidelines are that you're looking at to say whether Iowa would do that?
You know, I think he probably did exactly what I did. So he started out, he made his decisions based on data. I don't know what Governor DeSantis's metrics were. I am working with the Department of Public Health, and they're working with the expertise of the epidemiologist team in conjunction with the CDC, in conjunction with what they're learning from other states across this country. And we will continue to make the decisions based on the data that we have, just like I've indicated every single day, and that could change tomorrow depending on what the data drives. And so until then, stay home, limit your trips outside of your home, make sure that they're essential. If you have an older adult, make sure that they're getting what they need, but you can do it via a telephone or text. Practice social distancing. If you want to go outdoors, do it responsible. Work from home if you can, and isolate yourself if you're sick.
First question, Kay Henderson.
Governor, Lynn, Johnson, and Washington counties have more than a third of the state's COVID-19 cases. So if you could just clarify, are you considering regional orders, or are your proclamations with restrictions going to continue having statewide application?
No, I've said all along that we are able to look at the metrics based on communities, based on counties, based on regions. And so, you know, there's various ways that we can look at the information and the metrics that we're looking at that the Department of Public Health and we are looking at to make the decisions going forward, as well as other assumptions are going into that factoring as well. Do you have anything to add to that? So, same thing applies.
So just to clarify, that is to say that you could do that?
Yeah, I said that from the very beginning. So that's why, and you know, they are in different states. I mean, there are different variations of the impact across the state. And so that's why we're going to make the decisions based on the data that we have, and we're going to try to identify where some of the hot spots are. We'll continue to work with them, see if there's additional directives that we need to put in place that could help mitigate what we're starting to see there. But we start every day reviewing the data, and we end every day reviewing the data.
Barbara Rodriguez.
Governor, you keep referencing the data that you have and the data that you're reviewing at the beginning of the day and at the end of the day. When will the public see that data? Are you prepared to share specific information that shows
Parameters.
that your office is doing enough without a mandatory stay-at-home order?
So we're looking at the percent of the population greater than 65. We're looking at the percentage of identified cases requiring hospitalization. We're looking at the rate per 100,000 impacted in the past 14 days. We're looking at the number of long-term care outbreaks. So those are some of the metrics that we're looking at, but there are other assumptions that are going into it as well. But those are some of the metrics that we're looking at to determine what is the best method and what's the best decisions going forward.
Dave Price.
Good afternoon, Governor. As the Trump administration is taking a more longer-term view of this, perhaps the Vice President today saying that he would expect businesses and such to return maybe more to normal in June. As Iowans hear those, particularly those in the education community that have waited to see if you are going to extend your recommendation past April the 13th, should they be now prepared that there will be no more school for this year and they won't be back to the fall?
So we started our day working on this, and I know that the Director Lebo has put a task force together to really identify what this looks like and how we can continue to provide learning for students all across the state. So I had indicated earlier this week that this is Wednesday, by tomorrow, I think we'll be issuing an additional health emergency declaration that will address the very question that you're talking about. But right now, we still haven't really reached the peak. So that's probably 2 to 3 weeks out. So we're still, our numbers are still going up, and as we anticipated that they would. So, as we're looking at metrics to decide what we do and the actions that need to be taken and when that anticipated peak will be, we're also talking at the same time about metrics that we can use and apply that will allow us to open up the economy too, and that might happen in different pockets of the state as well. So, while we're focused on protecting Iowans, especially those that are vulnerable, and we're making sure that we're doing everything we can to avoid a surge and to overwhelm our hospitals and to really flatten the curve, we're also talking and putting in place metrics that we can use to, I think, as I'll use Dr. Padotti's term again, dial up and dial back, so that we can think about how we can do it in a strategic and making sure that we're still taking the health of Iowans into account, but looking for ways and metrics that we can use to open back up the economy.
Aaron Murphy, Lee News.
Thank you, Governor. To follow back on the discussion earlier on some of the models and projections, I think you guys were talking about the IHME
Yep.
model in particular. So just to follow up real quick on that, is it safe to say, and I don't know if this is maybe a question for Sarah, that you don't expect to see numbers as high because of the reasons you listed, that they didn't take into account some of those measures that have been put in place here? Is it safe to say that you don't expect the numbers to be as high in Iowa as what is projected in that particular model?
Well, what I can say that we're doing is we're doing everything we can to hopefully, keep the numbers as low as we can to protect the health and well-being of Iowans, especially those that are vulnerable to COVID-19. I think what Sarah was saying is the model that's out there does not reflect a lot of the mitigation practices that we put in place, and so that will have some bearing on the numbers. But again, these are projections. It's based on assumptions, and every day, we're learning new things and we're gathering more information, we're testing more, and hopefully they'll come up with a test. They're talking about it where we can test to see if you have any antibodies, so that if you have had COVID-19 and aren't aware of it, that also can go into some of the evaluation and some of the assumptions that we're using.
Jim, Perry News.
Thank you, Governor Reynolds. We've seen reports in recent days about some tension between states like New York and Rhode Island, as people understandably try to flee the hot spots for the hinterland. I wonder, are there any contingency plans in place here in Iowa for, if there were a wave of people from Chicago wanting to come into Iowa?
Well, no, there isn't yet. I mean, we haven't, but I can tell you that, and I've said this before, at least once a week, if not 2 to 3 times a week, we're on a call with governors from all across the country. I'm in close contact with a lot of my colleagues, especially surrounding states, to see what they're experiencing. We also talked about just regionally PPE and testing and just some of the materials that we need to take care of the individuals that have been impacted by COVID-19. So there is a great deal of communication already taking place between governors, especially governors that with connecting states. And so there's a lot of conversations going on every week and multiple times a week, actually.
Chris, KCCI.
Hi there, Governor. This is kind of a very Iowa question, but right now in Wayne County, officials there are very concerned about a horse auction that's set to take place tomorrow, expecting to draw about 100 people or more. A county official was quoted in the local paper. They're saying that the current regulations on this topic related to COVID-19 are vague and almost worthless. They say they've been in contact with the state. So is this something you're considering any kind of emergency order on? Is this concerning you right now?
Well, we're doing everything we can to protect the health and well-being, and we put a lot of guidance in place. Right now, livestock auctions are not exempt because they are part of the food production supply chain. And so I know that IDOLS, as well as the Department of Public Health, have put together guidelines so that they can safely hold some of these auctions. There's also, that's not the case, I don't believe, with this one, but with some of the other ones that are being held, they're able to utilize a virtual aspect of the auctions as well. So that is already taking place. They need to practice social distancing. They need to, adhere to the guidelines that have been in place by the Department of Agriculture as well as the Department of Public Health.
Caleb, Daily Iowan.
Hey, Governor. That model that you've been referencing predicts that we'll reach peak resource usage by April 30th, making us one of the last days to peak. So given what you said about those assumptions, do you think that peak will come earlier? And then also, there have been reports that the CDC is reevaluating its recommendation on healthy people wearing masks. I was wondering if the IDPH is considering recommending universal mask usage, and if that recommendation does come, how would that affect mask shortages we're already seeing in our healthcare facilities?
Well, again, if we've seen anything, it's how fluid the situation is and how recommendations and information changes sometimes daily, sometimes weekly. So we're constantly coordinating with the CDC and the administration with our local Department of Public Health and the expertise that they have. I don't know if you want to I'm not sure the beds were even accurate. I mean, there was some with that modeling again.
Yeah. So with the modeling, that doesn't necessarily reflect today's information about what bed availability is. And, in terms of the peak, I think that I said on Sunday that we think that we'll see the first peak in Iowa in the next 2 to 3 weeks. I think we still believe that that will be the case. We have indicated all along that our case numbers are going to continue to grow. That's because the incubation period of this virus is 14 days. And so it takes a while for us to understand what the impacts of the various mitigation measures are. But we, based on information that we have available to us right now and the planning work that's going on regionally, we feel like if everybody in Iowa will follow the social distancing, stay home as much as possible. When you do go out, make sure you're social distancing. If you do need to gather, make sure you're in groups of less than 10, and while you're doing that you're socially distanced. We do believe that if everybody follows those procedures that we've been asking them to do, that the governor has been asking people to do, that our healthcare system will be able to withstand the impact of this disease when we do see that peak in the next 2 to 3 weeks.
We're taking 2 more questions. Brian Morelli, Cedar Rapids Gazette.
Thank you. I have a question about contact tracing. CDC recommends this as a way to help mitigate the spread of COVID-19. I had a kind of a 2-part question. One is about what's going on now. To what level is this occurring? How is it coordinated between state and local levels? And how effective has it been? And then secondly, as spread continues, do you believe you'll be able to continue doing this in a meaningful way? Or at some point, do you think you'd have to throw in the towel on this as a strategy?
Department of Public Health is actually doing that, so I'm going to have Sarah answer that question. They've done a really good job.
So in the early days of our first cases in the state, the Iowa Department of Public Health and our team of epidemiologists did do all of the contact tracing at the state level. As our case numbers have continued to increase, that work has been turned over to local county public health departments. And so we provide them guidance. We communicate with those local county health departments regularly, and we provide technical assistance to them should they have questions about how to do this contact tracing. But local public health agencies do continue to do contact tracing on new cases as they're identified, and those local public health agencies will reach out to people that have been in close contact with any identified cases to let them know that they have been in close contact with an identified COVID-19 case, and give those individuals information about what they need to do to protect the health of themselves as well as their families, their coworkers, their neighbors, and their communities.
Last question, we're going back to Stephen, who's got a question from a local paper.
Yeah, Governor, this question is about farming practices and if there's any mitigation efforts in place to keep farming communities healthy as we're approaching the planting season. Essentially, concerned that this season is coming up, farmers have to be out in the fields and doing their planting, and if there's any efforts that you're taking to make sure that that population stays healthy.
Well, that they practice social distancing pretty well as they're in that tractor getting ready to put the crops in the field. So, I think they just need to do the same thing that we've asked everybody to do. As Sarah just eloquently stated, if you practice what we're telling you to practice, we will get through this sooner rather than later. We really will impact how this disease will impact vulnerable Iowans, and we will flatten the curve. We'll get through this sooner rather than later, and we'll help not overwhelm our hospital system. So they just need to practice the same thing that every single Iowan needs to practice. Thank you.